there's a disconnect in the value that you have, and it's almost like it's like behind a curtain. And we need to connect the dots, the value that you have, but with their language of like, and their belief and trust that. All right, Dave Kittle here with Poras Mehta. Poras, we were just talking before, we're reviewing patients, but then we were talking about plan of care. So the presenting the plan of care and getting buy-in to the plan of care, this is just one of many talks and trainings and coaching sessions and mentoring sessions that we're going to do. It's nothing against you or any other therapist when we do this multiple times. And even my business coach, that's a physical therapist, Sturdy McKee, he mentioned and reminded me recently that the physical therapist's most important job is to present the plan of care and get buy-in to the plan of care. I think most physical therapists think that their main job is to treat patients. And if you ask them a little more directly, they might say to evaluate and then treat patients. But you can't treat patients and treat the follow visits unless there's buy-in to the plan of care, because if there's not buy-in to the plan of care, then the patient drops off, they no-show, they don't come to all those follow visits to actually complete the treatment that we're talking about and to help them back to their goals and to help them reach the results that they want to get to, whatever that is to them. Does that make sense?
Yeah.
All right. So I want this to be collaborative, back and forth. Let's review where you're at right now in terms of like your understanding of the plan of care.
So basically, my understanding of the plan of care is to give the patient a particular idea, basically like a very good idea of where he or she is at or where they are at, how many visits would they need to get better, with a little bit of like a confirmed, you need to do so and so number of things for so and so number of visits for you to get where you want to be. And understanding basically, like we discussed in the previous Zoom call, why they are with us. Why did they reach out to us when there are, say, multiple options available, or after going to so many places, why did they finally come to us? Why are they so motivated to get better? Find out the whys, capitalize on that.
Okay, so give it to me again. Like let's say you were helping me train a new therapist, and like I know you kind of just reviewed it. I'm kind of asking you to like say it again, but like if I'm using your help to hire a new therapist, train a new therapist. We're meeting for coffee, for pizza, for lunch, whatever. And we're talking about this topic and the importance of presenting the plan of care, which again, we don't learn in school. Most therapists, I think every physical therapist we don't learn it in school. So it's not their fault. They don't know it. And not every job or company even trains on it or teaches physical therapists how to do it, or that it's even important. So it's not your fault. It's no other therapist's fault.
Mm-hmm.
But just give me another insight or thought around if it's you and I and a new therapist that's coming into Concierge Pain Relief. We're sitting, having coffee. We're talking about presenting and getting buy-in to the plan of care. What do you got?
Basically, the first most important thing I do, I'll just say what I do, is listening to the patient first and trying to understand what is the real problem, not the clinical stuff. Like, for example, without taking names of the patient, since we are recording it, a new patient came to us with knee pain, knee fracture or elbow fracture. She also has dementia. The only thing that was bothering her was she was not able to go back to her ballet days where she used to dance and independently roam around and go for ballet shows almost every day. Like, she was a part of a couple of ballet functionaries, like the ballet something associations of New York or Florida. She being the president of that and not being able to go and attend ballet concerts or any artistic theatrical shows, that was pinching her. So we need to basically make her buy into the idea of us helping her get better so that she can go do her ballet, theater, or go back to her working days. That's the most important thing, because only that is going to push the patient to pay us for us to go back and treat them. Number two is giving them a definite idea of maybe like ballpark figure, not something really aggressive like, oh, I can get you better in 3 weeks, when it originally takes around 12 to 16 weeks. But you need to give them a particular number, like you and me had discussed previously, where you told me it's very important for me to tell them it's not that you might take around 12 to 14 weeks. No, that's not how we need to say it. Within 12 weeks, you should be where you want to be. And then we can break it down that in the first 6 weeks, we expect this. In the next couple of weeks, we will progress, and then we expect this. And by the end of the 12th week, I think you should be good to go. So we understand the whys of the patient, why the patient wants to do it with us. Once we understand that, we immediately improvise on the spot and make the patient believe how we, with our expertise, can help her get her why, and then how much time the why will take.
All right. So we previously, and sometimes the challenge is about giving them a certain number of visits to complete the plan of care. I know for our clientele, sometimes it's challenging. I think it's a little easier if it's like an orthopedic issue, an ankle sprain, shoulder pain, something like that. It's someone who's active and motivated, and maybe it's the first or second time they've ever had shoulder pain. And I think it's easier to do the evaluation. And at the end of the evaluation, you say, hey, you're going to need 10 visits. It's going to be 2 visits for the next 5 weeks. Does that make sense? Do you have any, and also, do you have anything in the next 5 weeks? Do you have anything in your work that would get in the way of that? Do you have any trip, any work travel, any personal travel? Do you have any doctor's appointments? Do you have anything on your calendar in the next 5 weeks that would not allow you to be able to do that?
Correct.
To complete the 2 visits a week, Monday, Thursday, Tuesday, Thursday, Tuesday, Friday, it doesn't matter. That's the game plan. I'm laying out the game plan 2 times a week for the next 5 weeks, 10 visits for us to resolve the shoulder pain and get you back to overhead lifting with CrossFit or whatever the thing is. That is a little easier. And I have to agree with you, it is more challenging with some of our other involved clients where there's chronic pain, it's a neurological condition, Parkinson's, multiple sclerosis, and or very low functioning, or they were discharged from a hospital, or they've just had medical issues for the past 10 years. And maybe there's, you and I have shared different clients. So clients that have had a cardiothoracic, cardiopulmonary involvement on top of some orthopedic stuff or any type of mix.
Yeah.
For those types of clients, I understand it is challenging to say I don't know, it's like 12 weeks. It could be 6 months. I mean, depending on what it is. And that's why we want to find out what is the thing that they really care about and what they want to get back to. And we have to really define it. So for the one client we're talking about with the cardiac history, it might have been golfing or putting or walking into Central Park or walking around the reservoir or going to restaurants with his wife or traveling with his wife or whatever the most important thing is. It's okay to say, hey, I can help you with here's where you're at now. And you want to get back to that. And the last time you were there was 1 or 2 years ago, or maybe it was 5 or 10 years ago. However, whatever it is, it would take this amount of time for us to get to this, to bridge this really big gap. And I don't want that to seem insurmountable. I don't want that to seem like it's so far away. So there might be smaller things that we can mention as focusing the plan of care, like breaking a big plan of care down to smaller steps. And for the one client that we've shared that we're talking about with the cardiac history, when that individual had the the heart surgery, one of the first things that they wanted to do was just get back to putting a golf ball in their living room, right?
Right.
So like the initial plan of care could have said, okay, we're going to work on X, Y, Z. And after the first 8 visits or within 8 visits or within 1 month, and it could be 15 visits, whatever the visit is, between now and 1 month from now, you'll be clear to do, whatever, more rotation. You have grip strength. So it would be feasible to have the first month focused around getting back to putting without loss of balance, without shortness of breath, whatever, like without, safety hazards or safety issues. The first month, the first 15, whatever visits, we're going to go, and here's what we're going to break it down. We're going to do all this other stuff: mobility, gait, walking, stability. We're going to be checking your vital signs before, during, and after all these visits. And the first milestone might be putting in your living room, because that is what they said was important to them.
Right.
And that individual now has been with us for over a year and 2 months or something, or a month. It's that individual has been with us for a while in terms of getting back to full function. So
Right.
when I did the evaluation with that individual last year, I agree with you. Like, I wasn't saying like, hey, you'll get back to like 80% of your normal self, but it's going to take 14 months. Like, I didn't lay out that whole plan of care. So I even need to do a better job at this as well, even though I'm not really treating patients anymore, and you guys are treating the patients. So when someone is, and maybe I'll have to run this by Sturdy McKee, my partner, my business coach. Like, if we have someone that is either has multiple comorbidities, or they have a lot of chronic pain, or they're multiple sclerosis, maybe they're in a power wheelchair, maybe they need a lot of assistance, I should ask him, and I can ask him, how would you, Sturdy, or how would a great physical therapist present the plan of care? And if it's the person wants to get back to walking independently, but they've been in a power wheelchair for 5 or 10 years, maybe walking independently is not possible. Maybe it's not even possible for them to walk with a rolling walker and a physical therapist aid, handheld assist next to them. Maybe that's not even possible. So it's challenging. Like I said, it's easier when it's CrossFit, baseball player, soccer player that was younger that you treated, that was, coming off ACL, that's very, like, they have the surgery. It's very easy to say, okay, in 1 month, you'll be able to do this. And in 3 months, you'll be able to do this. In 6 months, I foresee you to be able to do, cutting, sprinting, all that type of stuff. Return to play, practicing, whatever it is. Does that make sense?
Yeah.
Is that something that, because historically, I know you have experience with like I would say, like, quote unquote, respectfully, like the easy orthopedic conditions. I think it's a lot easier for any therapist to present that plan of care and to do that type of an evaluation. And it seems like you agree that the involved neurological chronic type component, or multiple systems, multiple comorbidities, are you finding it more challenging to present that plan of care? And you don't want to be so honest and truthful with them about, like, it's really going to be a long road. Are you having trouble with
No, it's not about
that, or getting that out of them?
It's not about having trouble with them, but even not just them. It's even like a recent patient who stayed, Upper East. She just came to us she had knee pain, and she just came to us for one session. She didn't have multiple injuries or multiple involvements. She was pretty fit. She had a treadmill in her house. She was walking. She was exercising. But still, she just didn't want to do physical therapy because she said, I can do this at home. I'm sure even you spoke to her. So in such cases, what can you do? Though I tried the last option I gave her was, let's do a half an hour slot where I just come in and upgrade the exercises for you, see if you're doing them well, and then we could keep doing this every 2 weeks. So something is better than nothing, But pa patients who have this chronic pain, I think more often than not, they want to hear that they will get better and they will, like, we will be able to get them out of it because they have lost the control over their problem. They want to basically hand over the reins of their problem into our hands and want us to do everything that we can possibly do to get them out of this whole situation that they are in. If they're ready to put in the effort, after that, there are two kinds. If they're ready to put in the effort and there's somebody who comes in just to see, oh, let's see if this guy can do something what nobody has been able to do. When they come in with that challenging mindset and you can show them results in the first 1 or 2 days, then invariably they stick for the next couple of weeks at least. Even after those first 2 sessions, if they don't get any result, they will be in that hope that I will get that result sooner, and then they stick with us for a long time. Even if you don't give them results, they still do stick with us, and definitely we will do something right, so they are going to get better eventually. But then there are certain cases who are, like I said, just want to challenge you. Let's see if you can do it. And if you don't meet their expectations in their head of getting rid of their old chronic pain in a day or 2 or 3, irrespective of our plan of care or how many of a session we have locked in with them, they kind of chicken out. So that's what I was suggesting to you, that if we have, it's not important to just say 12 or 16 sessions to them. If we can make them lock in and prepay for those amount of sessions, it'll give them an added benefit, or basically, like, I don't know the word for it, the added motivation to stick around for a longer time. Because many a times chronic patients lose the battle mentally before they actually start losing it, because I think it's like PTSD or self-sabotaging behavior, because the brain has already sensed failure before with other therapists. So the brain tries to protect us, and it happens with all of us humans. Like, it tries to protect us from failure. So before we can actually fail, the brain loses out and gives up so that we don't have to face that failure again. So they give up. So if we can give them that added motivation to stick around with us because they have signed up for a couple of sessions, we can make them sign a document or something that, that you are in for these number of sessions.
Well, obviously and we only have a few minutes left, but without mentioning their name, that one client that signed up for they paid for a 12 pack, a 12 visit pack, but that was after the evaluation. So we could talk more about that moving forward, but it's hard for us to sell the package or getting full buy-in where they're financially committed also. The form and, the signing of an agreement, that's easy. That's why the evaluation. So we speak with them, then therapist goes, evaluates them, potentially gets them to feel a little bit better, or, more hope, or better. They feel better, they walk better, they have some reassurance or whatever. You do the evaluation, whether that's through their out-of-network insurance or self-pay or whatever. Once the evaluation's done, then then we can present like a package of visits that also can correlate to either completing the plan of care, or if it's like someone who's got like major chronic issues, it's a 6-visit or it's a 12-visit package. But the package, the whole point of the package is, within this package, we're going to accomplish one thing. And the thing might be getting out of bed without pain. I don't know. It could be toileting. It could be sitting down and getting back up from the toilet independently without an aide or nurse or physical therapist or family member or whatever. Or maybe it's walking down the stairs or down the hallway, or making themselves lunch, or walking outside to the curb, getting into a cab, a taxi, an Uber, whatever it is. That we could talk more about in the coming, days and weeks. I want to go back to the one individual, the woman who just wanted to do like one visit, and then you did like you pitched the 30-minute follow-up visits, because usually we do 1-hour visits. So with that obviously without mentioning her name, with her situation, what was her main thing? And if you can't recall it, but if you can recall it, like what's her? I know it was knee pain, but
I
is
don't
there
remember it.
what's your understanding of like, hey, if you wave a magic wand, what do you wish could happen? Meaning, like, if you didn't have this knee pain, what would you want to be able to do in life?
Yeah.
What was one or two of those things?
So first thing is they love hosting people for parties and for people coming over, hosting people. So she loves to cook for them. She cooks everything.
Okay.
Whether it's a group of 6 or 16 or 20, she cooks. And when she comes to the Poconos in Pennsylvania, she says she has a number of steps in her house. I'm not sure if the kitchen is down or up, but irrespective, she has to go to the kitchen to cook. Or
Okay.
she has to come back from the kitchen.
Perfect. I don't mean to cut in because we only have 3 minutes left because you and I both have to run really, really, really quick. So for that person that has a big flight of stairs because they live in the city, they also have a place in Pennsylvania, whatever it is, they want to host people. They want to, if you're cooking for people, right? If you're hosting people, you need your knees, you need your legs, you need your leg strength. You don't want your knee to buckle or be throbbing or in pain and have to sit down and ice it. And then you feel like you're not a good host and you feel like you're letting your guests down. You feel like you're letting your family down, right? So my question to you really quick, if she only does one visit and now I think you're seeing her on, Monday.
Monday.
You're doing, yeah. So I think you're having like your second visit with her, but now it's been 2 or 3 or whatever weeks in between. If she truly understood about what you can help her with, and I know you can clinically, I know you can, is that the best path for her? The way she's scheduling out visits, is that the best path for her to get resilient and strong, to host more people, to not have her knee be holding her back?
Definitely.
The way that she's booking visits with us, is that the best way for her?
Definitely not.
Okay, so if she were on this Zoom call, what would you say to her? What would be the reframe, or what would you say if, I don't know, if money and time or whatever was not an issue? If it was a family member, if she was a family member of yours or mine, what would you say to her?
Most importantly, if you want to do what you want to do in terms of hosting people, cooking, being there for them, standing along with them and not just sitting away, giving the control of the food and hospitality to somebody else. If you want to continue doing that, it's better you see, you just basically be more regular with sessions, because the more frequent you are doing physical therapy physically with us, we could bring those changes quicker rather than you taking 5 exercises and doing them for 3 weeks.
Perfect, but last minute, you just said more regular. I want you to tell me, if she was on the Zoom call right now, what would you tell her is the game plan of however many visits or time? Tell me exactly.
This is what I told her last time.
It's a family member, it's a friend. It's like, you don't care what they're going to get offended or not. Like, what would be, if it was my mom, it was your mother, like, what would be the exact game plan of care that would be best for her, in her best interests? What would it be?
This is what I told her. I told her that for the next 3 weeks, I want to see you for 3 times a week. After that, you will be out of your pain phase, and then you will solely focus on exercises where you'll have to come for 2 times a week for the next 3 weeks. So 3 weeks, 3 weeks, 6 weeks, first 3 weeks, 3 times a week, then 2 times a week.
So what's that? 15 visits, 9, 3 by 3,
2 3 is 6, 15 visits. Yeah.
15. And she said no to that, or she didn't fully buy into that. She said, I want to.
She said no
do the
because she
exercise.
travels. She said no because she doesn't stay in the city. She's out most of the days.
You could do virtual stuff with her in between.
100%. I offered that, but she was just, I think she said it's too much for her to pay for 3 times a week. That's at the end she said that.
But
that's what I told her, that if you do half a session, would you be able? Would you do more frequently if you do a half a session? So yeah, let me talk to him. If he's okay with that, then I can do more sessions for half slots.
but she lives in one of the wealthiest zip codes in the country.
100%.
And then she has a house in Pennsylvania with steps and all that. So it sounds like a bigger house. So they have assets, they have money. We don't have time to go into it. We'll do it on other calls. In my opinion, when someone says that it's too expensive, people say that to other physical therapists across the country when it's like
$100.
$90 a visit, $100 a visit. So we don't have time to go into it. We will in the future. When someone says it's too expensive or that's more than I thought it would be, or wow, I'm surprised it costs that much or whatever, it's because they are not seeing the value. And I know, Poras, you've treated me, I've evaluated you, hired you, coached you, mentored you. Like, I know what you do is valuable. So there's a disconnect sometimes, and it's not always your fault. It's partly my fault. I need to do better with training you. But there's a disconnect in the value that you have, and it's almost like it's like behind a curtain. And we need to connect the dots, the value that you have, but with their language of like, and their belief and trust that you can actually help them get back to the things they want to do, hosting family and friends and all that at the parties of wherever it is in Pennsylvania or New York. But they are lying to you respectfully. They are lying. They're whether they know it or not, they're using a filler word to do what they want to do, or they didn't fully understand your treatment plan and their involvement, because I know it's their involvement plus our involvement. So we can't do it for them. We can do half and they have to do half. Again, I got to run. You have to run. We'll talk more about this soon, but think about anytime someone, especially in New York City, like in these big wealthy buildings, these people have, typically a good amount of money and assets and all that, and they're spending the same type of money on like other stuff. They're spending that amount of money on groceries when they host a party of 6 people or 16 people, right? So they don't see the value. And so we all collectively, our Concierge Pain Relief, need to do a better job at presenting the value and using their words with connecting their goals, getting them back to doing the things they want to do. But anyway, we're running out of time. We're over time.
We'll do this next time. I mean, we'll start with this immediately next time.
Yeah. Thank you so much for your time, especially on a Saturday morning. I appreciate you.
Welcome. Most welcome, Dave. Thank you so much. Have a good one. See you.
Bye now.
Hey, it's Dave Kittle. Are you a healthcare business owner or physical therapy practice owner who is looking to figure out your succession plan or exit strategy? We might be able to help. And in fact, we may be interested in acquiring your practice. If you're interested, you can reach out to me. Shoot me an email at dave@conciergepainrelief.com. That's DAVE at CONCIERGE painrelief.com. Or you can call me at any time, 646-781-8884.